say that health, it is not only the health sector, but everyone has a role and responsibility all together. That means even though we can promote in this idea, we can make like a safer world and the healthier people. สวัสดีค่ะ
สวัสดีค่ะ Welcome to Thai Pulse. Many of the world's major disease outbreaks have originated from animals. But what are zoonotic diseases and how can we prevent and respond to them? Today, we discuss with an expert about that.
สวัสดีค่ะ
Thank you very much for joining our program today. So, Doctor, could you please briefly introduce your work in veterinary public health and your role on global stage?
Yeah, I understand that when the people heard about veterinarian, you may think about this is well like the doctor who take care of in their animal. It can be dog, cats, or like a livestock. But actually, for the veterinarian, we have like a really multi-disciplines. For example, bring something that you would like to eat. That means you I think you have heard about like a farm to table. It means that like a veterinarian have to take care the animal is safe enough for the people to consume it. Okay, this is one thing for the veterinary public health. And another thing that we work for is called like some animal. It can be transmitted the disease from animal to human. That means in the veterinary public health, we need to prevent those kind of the transmission. My position right now is a veterinarian, but work at in the Ministry of Public Health at the Department of Disease Control. So what the law under like the responsibility of in the veterinary public health is mean that for some diseases that in the we may have heard many times, several times. For example, rabies, or in the last year we have like anthrax. Is another diseases. So what we are doing for the veterinary public health at the Department of Disease Control, we work together within the other friends, other colleagues, for example, like within the public health officers, within the medical doctors, to identify the source of infection. So that's why when we have like already identified the source of infection that may occur in animal, we work within the other partner, just like our Department of Livestock Development or within the local authority to control the disease in animal and prevent that outbreak not happen again in the future. Okay, this is a direct responsibility what we are doing within the in the term of veterinary public health at the Department of Disease Control. But actually, it's quite broad issue that we work. It's just not only for in the control the outbreak, but like AMR, antimicrobial resistance. This is another discipline that in the we work and prevent the disease to human.
Right. So many diseases come from animals, right? And it's transmitted from animals to humans. In academic term, it's called zoonotic disease, right? So why should people be aware of this term?
Okay. First of all, we have to think about I think maybe both of you also have dog or cats, okay?
Yes.
Some people live like a fish, maybe there some are snake as well, right? So that means all of us quite close to animal. So sometimes we like touch them. That means we have like a direct contact within the animal. So that means if the disease already been in the animal, so easily for us, right, to get directly the disease from animal to us. Okay, this is a mean of in the zoonotic disease. Okay, and this is a direct contact, but sometimes it can be indirect contact as well. Even though we eat and like our meat or in the meat product is not like uncooked well, so that means there's some pathogen in those meat or the meat product can export to us from in their eating, right? So that means that it can be indirect contact from this.
And people are not aware of indirect contact that much.
Yeah, at this, sometimes we just like we did it like it's really like a teeny pathogen. So that means we couldn't see what diseases are already contaminated with that pathogen, and that's why the people didn't know or didn't aware what is kind of the disease. Yeah.
Can you give us a simple real-life example of the connection between humans, animals, and environmental health?
For in this T sector, T cars of in the human, animal, and environment, I would like to give in the one of in the maybe in the classical example. We call melioidosis. Melioidosis is a bacterial. It is one of the disease. Is in the if occur in human, is really like we call like a fatal disease, fatal pathogen, because then the human can just form in the maybe in the it's called like a moderate symptom, but it can change to in the fatal
Right.
symptom. In maybe in the within like 2 weeks, something like that. Finding that these pathogen, they are so contaminated, they mix within the soil or water. That means in environment, and even in that area, even that they have like a cattle, cow, or buffalo, that means they like live around there, right? Their disease can contaminate it, can like get selected into the cattle or animal or the buffalo. Sometimes this cattle sent to in the slaughterhouse, and even though we didn't like even though not go to in the like a standard slaughterhouse, maybe sometimes just like in the backyard, we kill the cattle or the cow without any like a standardization, like a standardized slaughterhouse. After in the we eat that, the meat or the product from those cattle, we can get their disease.
Zoonotic diseases spread more now than in the past?
Even though we use in the like epidemiological trends or in the we have like an analysis of in the situation, we found that is we can see more emerging infectious disease that from animal. And we may wonder what is the factor, why we can see more things. Because in the, right now, the people need easy to move, right? And sometimes it's easy to connect with nature, right? And so sometimes we expand our living, that means urban expansion to in the nature. This is habitat for animals. So we can see that in the right now the trend of the people, we easily to connect with the nature, and sometimes we occupy some habitats. It should not fall like a human, but we expand our farms, we expand in our occupation into the nature. That's meaning that we easier to connect between wildlife, animal, and human.
Right. That's the main factor, right?
Yes, I saw in the I think that we have heard about climate change. The climate factors is one of the problem, right? So the climate change can induce some animal or just some vector. Mosquito. I think in the maybe last year in Iceland they identify mosquito, and the mosquito can carry like some tropical diseases like a dengue. That means we can imagine that in the people in Iceland, that they may never contact with the dengue before, but when the mosquito come, right, that means they carry dengue virus as well. So that means we can see that the climate factor also induce the new diseases to the population at that.
So other than environmental disruption and the factors that you mentioned earlier that increases the risk of disease being spread, are there any other factors that you already mentioned?
And it's all within the behavior. The behavior of the people also change as well. We have like what is covered the behavior, and you can see right now when there are some people that love to go and trek in the forest, okay, and they may have like feel close to nature, but they didn't like prepare well to protect any pathogen, any diseases, maybe in their contact in there something in the forest, and then they may not show the clinical sign at that time, but after they went back to their homes, right, and they may carry those disease, and they can spread the disease to other family members as well. Okay, this is another thing that in there is kind of like a connected between human, animal, environment, and also like a behavior of the people.
Yeah.
But the fact that everything is kind of like mixed up because of climate change, for example, it makes the prevention more difficult than before, right?
Yeah. That's why because in April, just last in April, in France, in Lyon, their president, they proposed to conduct One Health Summit. That means that they ask for like all the leaders around the world to come and highlight the importance of prevention.
Yeah.
That means we know that, and what we learned from the COVID-19, we spend a lot of money for response, but that means the damage already occurred. And how we have to chip to increase the more engagements or in the investment for prevention, because we know that if we prevent well the disease, the outbreak not occur. That means we can save money to do another things.
We need to like train ourselves now to be aware, and at the same time just kind of get used to it in a way, because Thai people, we always get used to things very quickly. At first it might be a little bit chaotic, but you know, a while we'll get used to it.
Yeah, but I think the most important thing of all is vaccination.
And there's also some easy activity, easy manner that we can do. Keep safe, like wash your hands, and this is a gift to like a dog or cat to be vaccinated. And even there you observe something like okay, this activity, this thing not never happened before, consult the doctor or the veterinarian.
Right. Okay, we're gonna take a short break for now, and when we return, we'll focus our discussion on rabies and the One Health concept. We'll be right back.
Thailand steps onto the global economic stage once again. In 2026, we are honored to host the annual meetings of the International Monetary Fund and the World Bank Group, or the IMF World Bank Group Annual Meetings 2026. Often compared to the Financial Olympics, this platform gathers leaders and high-level representatives from 191 countries worldwide to shape the global economic and financial direction. Come make an impact and drive the future of the global economy together, right here in Thailand. The meetings will take place from October 12th to the 18th, 2026, at the Queen Sirikit National Convention Center.
Welcome back to Thai Pulse, and now this segment we're still talking about the zoonotic disease. So the most well-known zoonotic disease in Thailand, one of it is rabies, right? So why is it such a serious public concern in Thailand and in many countries as well?
Okay, rabies is one of the oldest disease. I think that we have learned that there are many cases, many deaths that from rabies, right? But sadly, that in the rabies is preventable disease by vaccines. But why we still have some cases that in the human already like die and the causative agent from rabies. What we learn, this is when even the people got their maybe got bitten from the dog or cat or scratch as well. And even the disease, even this rabies virus already like they say that and they get into their central nervous system in the brain. Even that they show the clinical sign, we can say that it's 100% fatal disease.
What do you mean exactly?
It's like we call it 100% case fatality rate. It means that even that they show the disease, they show the clinical sign, no treatment.
It's symptomatic treatment.
Yes,
right?
no. It are some diseases we can like use some specific treatment or either supportive treatment, but for rabies, die.
So
100%.
So you said 100 fatality rate.
Yeah.
So anyone who got this disease die.
Yeah. Even that they show the clinical symptoms, they show like they already show the clinical sign. But for the disease, supporting the today we got in the Britain for the rabid dogs.
Right.
Okay, they take times, maybe in on the finger. They go to in the nerve, right, and takes time to their CNS to the brain. So during that time, if we got the appropriate treatment, immunoglobulin or vaccine, they can block the virus.
Right.
That means we can save the lives. But even the virus already go and affected to CNS, to the brain. No
That's
treatment.
End of story.
Yeah, okay.
Oh, okay. So I think not everybody knows how fatal it is, but some do know that it's very dangerous, even though it's preventable if it doesn't reach your nervous system or your brain just yet. But what I really want to know is how fatal is it though? What is particularly dangerous about rabies other than what you mentioned?
Actually, in the most often the affected people is occur in our Asia and Africa. This year, Thailand, we have the rabies case in human. Right now, 6 cases. All of them die. Okay, and for in the ASEAN, in the some country in ASEAN, they allow have like a 300 death per year, over 300 deaths per year. Even that I would like to went back when I start to work at in the Department of Disease Control. And that time I have to like analyze the report, like an investigation report of in the rabies case in human. And that time around in the over 120 cases death per year. So it is quite huge number. Yeah, and we still, it is for like a human rabies case, death, but actually in animal, we still see some like a rabies in dog, in cats. So that's why it's still like the problem that in there still occur in our community in Thailand.
Yeah, we have a lot of strays too.
A lot of
Stray cats and dogs.
Yeah.
And actually, we made concern about stray dog and cat, but actually, there's sometimes even the dog and cat they have the like owner, right? But even that they didn't get the vaccine in the every year, they still have the chance to get into rabies.
Right.
Okay.
Even though, for example, if you raise your cat or your dog indoor all the time, never gone outside, never met any other pets, do they still have the possibility of getting rabies?
Yeah, for the first one, we have to make sure 100% that our dog and cats
Vaccinated.
vaccinated and never get out of the doors. But I think the dog and cat is quite difficult to quarantine 100%. And also the rabies virus, it does not affect it only in dog and cats, but all the mammals. So maybe rat, rodent, bat,
Cockroaches.
cockroaches
Can they
is not
carry
in the
those
mammal.
also?
But they have different kinds of mammals that you may concern that before they may leak and came to our house in the
squirrels.
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 Squirrel as well. Yeah, right. So that's why it's still we have to concern. It is not only dog or cats, but actually we have to understand that this occur in the different kinds of mammals.
So now we're in rainy season, and another well-known zoonotic virus is dengue, right? How serious it is in Thailand?
For the dengue, we also are categorized into the vector-borne disease. Okay, but mosquito is everyone when we born, right? We know mosquito. Okay, in the tropical region, so that's why everyone in the list of to get in the dengue virus because we have abundant mosquito in our country. So that's that's why you can see that from in the municipal public health and also in the educational program, we try to make like educated for the parents to understand even your children, even though or maybe sometimes it's just like yourself have show this clinical sign or in the fever. Like did it like and also during the rainy season,
Right.
think aware with the dengue, and then even they can go to like a medical doctor as in their nearby homes or in their health facility. They may think about the dengue and they can like provide the appropriate treatment for that.
Right. But the good thing about the dengue is that you can prevent it by one-time vaccination.
Yeah. Right now we have in the vaccination as well.
2 doses, right?
Yeah,
2
right.
to 3 doses.
Okay. I want to shift our attention to the One Health concept. In your opinion, what health risks should the world be focusing our attention on right now, especially in Asia?
Okay, if I can diseases that in there think about One Health and what in there we need to focus, I would like to say that the first line is emerging zoonotic diseases. So it's emerging because we call like emerging diseases. Maybe in the disease already been there. Maybe in the forest, we never discovered that. Like we never know about that. But even though we move to there and we do some activity that cause to those pathogens, they may become and detected, right? By the doctor, by the laboratory. That's why we call emerging zoonotic diseases because they may already there, but we never know. We know they already existed, okay? And the second one is an anti-AMR, we call antimicrobial drug resistant, because even though we still take antibiotics without in the prescription or didn't like take in the appropriate way, we may get in the AMR in our cell. So sometimes in the future, it's hard for us, right, to find what in the good antibiotic to fight the disease because we already been resistant for that microbial. And the last one is couple like a climate or factor that impact to health.
Right.
And also it can be vector-borne disease like a dengue, or it can be like something like a PM2.5 or in the El Nino that they already been less awareness about that. Okay, I think the issue that I would like to list that this is important and we need to prepare ourselves for that.
Right. The fact that you mentioned the concept One Health, I mean, we see this concept a lot in the public health landscape, right? So could you please explain to us what does One Health mean exactly?
One Health is already like this word is just not immersed. Actually, if we went back to like maybe 2004 during the avian influenza outbreak that hit in Thailand as well and also around the world. And that time we know that only one sector cannot contain the disease, cannot like contain avian influenza. We need to work within the other sectors, with different sectors, human, animal, and within the communities. That's why in all the world they say that okay, this is One Health because in the One Health is mean that we work among the sector to protect for within the healthy people, healthy animal, and also healthy environment. So that's why this One Health it already been used a lot.
Right.
Even though we would like to get more like engagement from the other sectors. Okay.
And recently you participated in the One Health Summit 2026 in Lyon, right?
Yeah,
That's in
right.
France, right?
In France.
So what's the purpose of the event and what are the key takeaways?
Yeah, or the one key takeaway, this is prevention. Because they try to like during the One Health Summit, it's just not only for in the health or health leaders, but they ask for like a scientist, health leaders, animal health, and also environmental health, and also within the like a NGO international organization. They say that prevention is not the cost, it's the investment that all the countries, all the sectors need to pay more. because in the big lesson learned from COVID-19, we spent like a lot of money for response after in the COVID-19 occur. But if we would like to do kind of to prevention, actually for like some zoonotic diseases or in the vector-borne diseases or the climate related to the health impact, they have the highlight the words of in the upstream prevention. That means prevent at the source. So that's why we have like we call PREZODE. PREZODE is just one of the international network that right now I resolved within the president of PREZODE, prevention of in the zoonotic disease emergence.
Right.
So the keywords is upstream prevention. Okay.
So why is international cooperation like this important in terms of preventing the zoonotic diseases?
It's when we said that the network, it means that we coordinated within the other partners. It's just not only for in the domestic resources, but we learn within the other partners, and we can see what the best practices that they use at and they did well in their countries. And also we can learn from the challenges that those countries develop and they share the experiences. So that's why even though we learn from the other countries, that means the country can adapt that and use and pick the appropriate choice to apply in their country. Okay, this is meaning the challenging experiences. But another way that we do in the term of in the network, we work within the like some grant. That means that we can see that what in there any investment on the any support that we can work within the other country and we can apply the grant and fill the gaps that maybe in the country need some resources, maybe the country need like some professional technician. So that's meaning that we can use that kind of the opportunity at the international cooperation to fill the gap in the country.
Finally, would you like to share a few words with the public on how they can better take care of themselves to lower the risk of health risk in general?
Yeah, that's when we said health, we may think about only, okay, this is like a responsibility of the law of in the health sector. But actually, everyone can pay this law. Because for example, for the general people, if you let dog or cat, okay, get them to be vaccinated in the light schedule, and then try to promote about in the good practices, like wash your hand and eat like cooked food. Okay, that is the thing that we can work. And also sometimes for in the animal health sector, they can help like do a lot of program that can promote healthy animal. That meaning that it's safe for the animal population and also for us as well. So that means when we say that health, it is not only the health sector, but everyone has a role and responsibility all together. That means even though we can promote in this idea, we can make like a safer world and the healthier people.
Right.
Thank you very much, Doctor, for joining our program today. สวัสดีค่ะ
สวัสดีค่ะ
From today's discussion reminds us that protecting public health is not only the responsibility of governments and experts, but something that also involves communities and individuals around the world.
And that's all for Thai Pulse this weekend. We see you again. สวัสดีค่ะ
สวัสดีค่ะ